Good morning, guys. We're all sparkly. We haven't spoken about estrogen recently, so I thought I'd do a little video. Estrogen is integral for mood, libido, cognitive function, cardiovascular health, bone strength, fertility, prostate health. The list goes on. However, in excess, it is deleterious. Why? Because every single hormone in excess causes negative side effects, much like a deficiency in every single hormone causes issues. There is no way that estrogen is the only hormone that can run wild. Well, it self-regulates. What, much like the HPG axis? Yeah, it self-regulates until it doesn't self-regulate. What sorts of things dysregulate the aromatase enzyme? Well, excess adiposity, you chunky monkeys. Liver dysregulation. The aromatase enzyme is located in the liver, so medications, alcohol, exposure to all sorts of toxins and pollutants can dysregulate the liver, the main organ in the body that detoxifies and metabolizes everything. It is essential to have good liver health. How do you do that? Eat real food, drink plenty of water. Remember what we are, animals. So, be more hunter-gatherer. What else? There does seem to be a small proportion of guys that, despite having healthy body weight, healthy diet, and a secondary healthy liver, still have a propensity to excess aromatization. How do we know this? Well, through optimizing their testosterone level, they have negative symptoms associated with excess estradiol. Now, we've just said estrogen is integral for mood, libido, and cognitive function. However, one of the commonest symptoms of excess estrogen compared to testosterone is anxiety, an uncomfortable feeling all the time, a disproportionate amount of stress and angst. It is not a nice place to be. We also joke about people being emotional. I always know when my E2 is creeping up when I listen to Johnny Cash Hurt and a little tear. No, I'm joking. It is an emotional song though. Amazing. Interestingly, a Nine Inch Nails cover. Johnny Cash covering a Nine Inch Nails song? Wow, it must have been good. So, cardiovascular health. Estrogen is integral for the endothelial lining of the blood vessel. But guess what too much does? Blood pressure issues, hypertension. When we think about bangers, we like to think about bangers. Estrogen is positive, testosterone and DHT is negative. So it is more complicated than that. You've got a prolactin, progesterone, IGF-1, etc. But when we think about these hormones, estrogen, testosterone and DHT, they're all anabolic hormones, but they all have slightly different effects on different tissues. So estrogen's excitatory, and as I just said, testosterone and DHT are inhibitory. So what do you want? A good ratio of testosterone to estrogen to DHT for what? Optimal health and well-being. Now, prostate health. Again, you need a nice ratio of all these three hormones. There is more emerging evidence to suggest that estradiol is the naughty hormone, not testosterone. So obviously, age is a risk factor for prostate cancer. What happens naturally when we age? Testosterone levels drop. what should also happen and isn't happening? Estrogen levels are not dropping. Unfortunately, they are rising as a result of what? Us being lazy, chunky monkeys. So, in essence, the ratio of testosterone to estrogen is abnormal. So the focus of our attention should be on normalizing this ratio. Now, how can you do that? Well, obviously, try and maintain a healthy body weight. How do you do that? Primarily through diet. As I've said before, we are not efficient at burning calories. Exercise is fine-tuning. Exercise is 100% necessary. As I've said before, we are physical beings in a world of psychological stress. We need to use our hormones appropriately. So that means physically. The stress hormones that get released as a result of psychological stress, noradrenaline, adrenaline, cortisol, they don't know the difference between psychological and physical stress. Being physical beings, let's get physical. So yeah, it's literally all about using your hormones appropriately. And how do you do that? Lead a healthy lifestyle, reducing stress, getting good sleep. Sleep is one of the most important factors, not only in natural testosterone production, because guess what? Your anabolic processes predominate overnight, but also it's restorative to this. Sleep on it. Sleep on that problem. And you wake up, yes, your brain is incredibly sophisticated and it has the capacity to problem solve if you allow it. So don't pollute it with alcohol, disappointing, and excess caffeine, because obviously caffeine is wakeful. And what do you need to do at night time, apart from a bit of nookie? Sleep. Get this working. What else? There are things like zinc, super effective for helping sleep and also modulating the aromatase enzyme. We're proponents of daily tadalafil. It's gold. Not only does it help with erections, because obviously it releases precursors to nitric oxide, it can help with your cardiovascular health. And if you take it daily, you can reach a steady state. So hopefully lower your blood pressure. But we also use it to help modulate estradiol, because it does bind to the aromatase enzyme. So as much as we want to avoid aromatase inhibitors, firstly, adjust your diet, adjust your stress levels, train, then look to modulation, tadalafil, and then, as a last resort, examestane. Now, we only use examestane when we need to use examestane, and we only use it for the shortest amount of time possible. We microdose examestane if necessary. Typical dosages, probably 0.5 milligrams. And remember, these tablets come in 25 milligrams. So we have a compounding pharmacy that do bespoke examestane capsules for us. Sometimes we need to use higher doses, but it's always with caution. Paracelsus, the dose makes the poison. Remember, if you drink too much water, it can kill you. So, when you embark on your journey to hormonal health, do so knowing that you've got to put the effort in to your lifestyle, your diet, and your exercise. You then need to place some trust in your TRT doctor and understand that hopefully, I say hopefully, because I know there's some people out there who are not doing this, they are acting in your best interests. You should have regular review. That means more than just the qualitative symptoms, it means quantitative markers, because a healthy male profile should have a cascade effect on your other physiological parameters. If you have a healthy male profile and you have distortion or dysregulation of other parameters, it is likely that there is another pathology, or you are not microdosing. So microdosing, the premise behind this is mimicking natural physiology. So if you have a less intensive injection frequency and you've got great trough levels, remember, those trough levels are simply indicative of your levels at the time of the test. So if you understand the premise behind what we're trying to achieve, which is what? Balance and stability, you will understand that microdosing is the most effective way of achieving stable male androgen levels. Daily injections of testosterone cypionate plus or minus 8 cg. Gold standard, baby.